Hey Sterling, hope you're doing well. I've recently ordered a 3-month subscription of Wood and Fire. Look forward to trying them. I've been trying to get intimate with my new partner recently, but I've noticed that I have been going limp just before penetration. However, I stay aroused during foreplay. Can you please advise how I can overcome this? Also, I know some older men in their late 40s or 50s have trouble with libido and erectile function. Is it safe for people at those ages to consume the Fire or Wood supplements? Yes, it's totally fine to consume both of those supplements, and that's exactly what they're actually engineered and formulated to help with that. Like the exact cause of guys getting erection and libido problems in their 40s and 50s. This supplement is designed specifically to fix that and fix long term. So that answers that second question. So the first question, you get intimate with your partner and you're fine during foreplay. So I'm assuming I'm assuming that means you're fine with her giving you a hand job, giving you a blow job, and you have an erection. So that means there's nothing wrong with your dick. Your dick works because you have an erection during foreplay. And then you go limp just before penetration. Now I don't know if you're using a condom or not. You haven't mentioned that. Some guys have problems with putting condoms on, or have problems with keeping an erection with a condom. If that's the case, I'm just adding this in case that's the case for you because you didn't mention it. If it's a condom thing, then you need to practice. You should practice using a condom when you masturbate because then you can get used to the feeling of actually being erect and aroused whilst you're wearing a condom. Put lubricant in the condom before you put it on. It makes it feel much better. And 3, have it like while she's sucking your dick, get the condom ready so you can slip it on straight away and then go into penetration immediately. So there's less downtime between you being fully aroused and you fucking around getting the condom on. That's if it's a condom issue. If it's not a condom issue, then this is entirely in your head. This is obvious. It's a clear-cut case of, if it's not a condom issue, this is a clear-cut case of performance anxiety, because you're aroused with a blowjob, and then you go to put it in, and nothing's working. That's you getting in your own head. That's you in a anxious state in your own mind. There's a few things you can do to help adjust this. One is increase your levels of GABA in your brain, supplementing with things like taurine, L-theanine, magnesium glycinate. These will all help with kind of naturally calming the mind a lot more. And 2, I don't know if you've bought it yet. My book on The Ultimate Guide to Performance Anxiety goes through a bunch of different mental techniques on this, specifically about how you can kind of overcome that anxious state and learning to recognize the trigger, learning to recognize what's actually causing that trigger. For you, it seems like there's obviously something you're doing every time that is triggering the anxiety. So you have to be a bit self-aware and introspective and look at exactly how you kind of set up sex. There's going to be some habit or routine you go through which is causing this. So you need to identify the trigger to start with, so you can break the trigger and break the habit and kind of fuck a little bit differently, or go initiate penetration a little bit differently, so you can start to break that habit loop in the first place. And you need to practice things like meditation and sparring to try and get better at being more present in the moment and less in your head. These will help you to naturally achieve that state a bit better. So if you're working on the performance anxiety part, if that is the problem, if it's a condom problem, we've mentioned the fixes to that already, but I suspect it's more of a performance anxiety issue with you.